Fibromyalgia does not kill anybody, but it can make a person want to kill themselves. Today we'll be talking about the diagnosis of fibromyalgia and the role of the tender point in fibromyalgia. These and many other things have been discussed among videos already released and will still be released on this channel. Please, if you like this kind of discussion, kindly subscribe to my channel and like this video. Thank you. There is no diagnostic test for fibromyalgia. There are now many suggested tests here and there, but none of them is specific for fibromyalgia. There are things that could point towards various forms of chronic widespread pain, but fibromyalgia is a complex disease which is primarily neurological and not autoimmune and is not associated with inflammation. Because of this, and because it can coexist with so many other conditions, it is always important to be able to identify it distinctly. But this is not always so straightforward. And this is the reason why a lot of efforts have gone into various research works to see how fibromyalgia can be correctly identified for various purposes. First, we're going to talk about how the trigger points or tender points of fibromyalgia came to be. In the 1990 American College of Rheumatology classification criteria, maps of the body were shown that identified spots in the body to press, to count and determine if the number of tender points reach a minimum threshold of 11 out of 18 to call or classify a case as fibromyalgia. It's important at this juncture to highlight that the trigger point or tender point, importantly, tender point criteria for fibromyalgia is primarily for research purposes and not for diagnosis. This is because the human body is going through a lot of this problem. Probably when it started, it was just 1 or 2 spots that were tender. Now, at that point, it doesn't mean it is anything less than fibromyalgia. But because it's a very wide spectrum, with some people having more intense disease or more profoundly widespread disease than other people, it is possible, it is important to get a crop of patients that are fairly similar for research purposes. And this is what led to the design of the fibromyalgia tender points that require counting a minimum of 11 before classifying patients as fibromyalgia. This is primarily for research. Therefore, patients that will be recruited for the purpose of research are required to have disease intensity of a minimum threshold, which could be of meaning when trying to compare various parameters in research. According to the 1990 American College of Rheumatology classification criteria for fibromyalgia, 11 tender spots are required out of a total of 18 to classify a patient as having fibromyalgia. And the various spots in the body to press are as shown in the picture. Now, the amount of pressure that is required is just about the amount of pressure required to blanch the nail bed using a thumb. So, if you press on those spots as highlighted in this image, from the two sides of the lower neck in front, the edge of the upper breast, arm near the elbows, knees on the inner sides, base of skull in the back of the head, back of the neck, back of the shoulders as shown, upper outer buttock, and the hip bone. If a total of 11 out of 18 is found to be tender, this is reported or classified as fibromyalgia. However, again, it is important to stress that this is primarily for research purposes, to help researchers gather a fairly homogeneous or fairly similar pattern or intensity of disease, not necessarily a yay or nay diagnostic criteria. So, tender points or trigger points. Tender points are used for the description of the spots all over the body that are tender in fibromyalgia. Trigger points are used specifically for myofascial pain syndrome, not classical fibromyalgia. So the diagnosis rests on primarily clinical presentation and the exclusion of other conditions. This is not to say that other conditions cannot coexist with fibromyalgia. In fact, in the American College of Rheumatology 1990 criteria, it requires that other conditions should be excluded that could explain the widespread pain the patient is having. Again, this refers to the importance of ensuring the right patients are recruited for the purpose of research. But in real life, it is not always like this. A patient can have fibromyalgia on top of many other conditions. and that makes it even more tricky. So, various investigations that are done in fibromyalgia are primarily to exclude other conditions and not necessarily to confirm fibromyalgia. However, since 2010, more criteria have emerged. These are manifestations of joint works of the American College of Rheumatology and the European Alliance Against or Associations for Rheumatology that led to diagnostic criteria that don't always require that a patient must not have anything else and do not necessarily depend on the presence of trigger points or tender points. Now, these criteria also pay more attention to the non-primary pain disorders of the body. These are called somatic symptoms, other bodily issues that patients could present with in the context of fibromyalgia. Some of these include things like headache, bladder spasm, Raynaud's phenomenon, and so on and so forth. So, as we have seen, a minimum of 11 tender spots are required to classify a case as fibromyalgia. But in real life, does it mean if a patient has 10 tender spots, they do not have fibromyalgia? This will not be the case, because typically before applying this, a patient should have been diagnosed with fibromyalgia first. But if this is the minimum criteria required for recruitment into a trial, then it should be applied. Next question is, how reliable are the tender spots in fibromyalgia? Well, for the purpose of diagnosis, I would not say they should be entirely relied upon, because as I said, they should not be the go-to test for the purpose of diagnosis, especially because symptoms and intensity of pain and tenderness can vary even in the same patient from time to time. So the fact that patient does not have up to 11 tender spots today does not mean they will not have 14 or more tomorrow or at other times. In essence, tender points are useful, and they are particularly useful for the purpose of recruitment into studies, but they are not on their own definitively conclusive to diagnose or exclude fibromyalgia, and they should not be seen as such. If you like this kind of content, kindly like my video and subscribe to the channel. Thank you.